Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just perform cosmetic or aesthetic plastic surgery. I have a very big practice, and I operate on all age groups and basically a lot of different ethnicities, etc. A common question I have posed from patients is, Dr. Shapiro, what is the right age, or what is the appropriate age to have a procedure performed, or what's the right age to have plastic surgery? And I think that answer to that question is really across the board. Whether we do plastic surgery in a child or an adult, of course, patients need to be healthy, so we do some kind of medical screening, and if people meet that criterion for being healthy for elective surgery, that makes them a candidate. The other things that are really important to understand is there are different procedures that have different age-appropriate configurations, if you will. Younger patients, the most common procedures would be things such as having your nose done, having your ears pulled back, and then as people get a little bit older, a breast augmentation. So when someone's a bit younger, usually the age is around 7 or 8 that we like to do an otoplasty. The reason being is that is when the ears are mature and people start to see some social interaction and with some negative reinforcement from other people. People might mention their ears. So before that age, we like not to do the otoplasty, and the appropriate age is around 7 or 8. As people age a little bit, they start seeing that they want to have their noses done, and really anywhere between around the end of 15 years to 16 and beyond is the appropriate age for having your nose done. The reason being is that most of the growth is finished, if you will, at that age, and basically we feel that patients are mature enough to get an idea of what they're looking for and tell me what kind of result they'd like to have. Of course, anybody who is less than 18 would need a consent signed with an adult, so probably a parent would have to sign that consent. As we get a little older, breast augmentation becomes more common, and we are, except for certain circumstances where there's a significant asymmetry of the breast and other circumstances, generally we don't like to perform a breast augmentation less than 18 years old. And a breast reduction also can be done in younger patients, presumably assuming that their breasts have completed their development. But 16 or so, sometimes we'll do a breast reduction. More of the elective facial procedures and some of the things like liposuction, as people get older, there are different ages in terms of being appropriate ages. Liposuction, probably the best results are when somebody is younger and has better skin tone, but the ages for liposuction can go across the board until someone is much older. When we start talking about facial surgery, such as a facelift or having your eyes done and having your neck done, usually the idea is that probably at a younger age your skin elasticity is the best it will ever be. So the younger the patient, probably the better the result. As a plastic surgeon, I try to screen patients to make sure that emotionally they're ready for that procedure. And if I think that somebody can wait to have a patient to have a procedure done at a later date with no real risk, if you will, of having less of a result, I'll tell people to postpone that surgery. In terms of older patients, there really is no cutoff in terms of plastic surgery for age. I think as long as somebody is physiologically healthy and gets clearance from their doctor, almost every age as people get older is appropriate to have cosmetic surgery. If there are mitigating factors, if there are patients that have problems with heart disease or lung disease, again, this is elective surgery, and we don't want the risk to be outweighed by the benefit. So really, plastic surgery is appropriate for many different ages, really depending upon the procedure. Of course, there are instances where a patient is too young in years to have surgery. They may want it, and it's probably not a great idea. But the best way to get an idea about where you are in terms of what you're looking for, whether or not you're too young or too old, is the best way to get an idea is to come in for a consultation. We'll talk about what you're looking for. We'll talk about the risks and benefits, and we'll talk about any kind of clearance that you may need prior to the surgical procedure. Thank you very much.